It is Thursday. That means we have a vet on hand to answer your pet questions. So if you have a problem with your pet, you can give us a call. The number is 460-KJRH. As always, it's Dr. Joe Landers here to answer your questions, and he's brought along Colonel Mustard this morning. Good morning.
Yes. Good morning.
I like that name.
Yes, and as Aaron said, it's Colonel Mustard with a rope in the studio. I guess someone was playing.
This is sort of his rope right here, isn't it?
Sort of a rope here, yeah.
But he's not going to kill us, is he?
Oh gosh, no.
Good.
No, he's a very nice guy. He's about a 2-year-old, and he is. We need to trim up his face a little bit more, but he is just a nice little dog. He kind of licks me.
A little too friendly, isn't he?
Well, you know, I tell people licking is a good sign because you can't bite when you lick. So it's in the dog world, that's a friendly deal. But he's a Lhasa Apso. If you look at his eyes really closely, they're kind of a weird blue in them. So he's got a little bit of a recessive gene somewhere. But honestly, he's a nice little guy, and we need to get a little haircut. But other than that, he's over at North 40, which is in Bixby.
Okay.
And
what's the number there? Do you know?
369-2287.
369-2287.
Yep.
If you want to get Colonel Mustard.
Yep. And he'll be back there this afternoon. So.
All right. Good deal. Well, let's go to the phones. First up today, we have Connie in Skiatook. Good morning, Connie.
Good morning.
What's your question?
Dr. Landers.
Hi.
I have a brindle boxer that weighs about 100 pounds. And I was giving him a bath a while ago in the bathtub because he'll just jump in there. And I had him all soapy and everything and was rinsing him off. He jumped out before I could get him rinsed completely off. And I was just wondering if that was going to be too much of an effect on him. Or
I mean, yeah, usually some soap and stuff can sometimes dry the skin or whatever, and a lot of times they'll kind of lick it, and sometimes that can upset their stomach if they get too much. But if, you know, I would try to get him back in there and rinse him off the rest of the way or whatever, and if he's kind of decides that he doesn't want to, if it's sort of on his own terms, usually we'll bait him with some food or something. A lot of times when we're bathing dogs that are nervous, we'll give them a little treat or something. But yeah, I'd get that bathe back off of him, so
all right. Let's go out to Broken Arrow and talk to Mary. Good morning, Mary.
Yes, good morning.
What's your
question? I have a Shih Tzu. Kind of looks a little bit like the dog that's there on television.
Yeah.
And he'll kind of lick his little paws and whatnot. But periodically he'll get, I don't know if it's a coughing or a choking. I don't know if he has a fur ball or what.
Yeah, it sounds like a little snort, like a kind of like that a little bit.
Yeah,
exactly.
But it's almost like he's trying to choke.
Oh, yeah, and they look like they stick their head out, and it just looks violent. That's usually what I think you're seeing there. It's called a reverse sneeze. I always tell people that dogs don't blow their nose forward like you and I with Kleenexes. They suck it all backwards. So what he's doing is he's actually passing air backwards, usually clearing some mucus out of their throat.
Okay.
It's not uncommon this time of year because they have allergies and stuff. Mostly allergies are in their skin, but some of them can produce some mucus. And just like all this rain we've had, you know, the mold comes up and then the grass grows and all that. So there's probably that there a little bit. Usually it's nothing to worry about as long as it doesn't, you know, they don't seem distressed. And if not, then bring them in and have them checked out for that.
That was a pretty good snort you did there.
Yeah, well, it's years of experience, and people will go, oh, that's it, you know, and I'd be like, oh, yeah, I have allergies too. So, you know,
I was impressed. I was impressed.
Well, thank you.
All right, next up we have Jeannie in Tulsa. Jeannie?
Hi, I have an 11-month-old large German Shepherd pup, and he came in last night, and I think he has a broke leg. And my question is, how could I splint that?
Well, usually what I would do is I'd have somebody make sure that it's a broke leg and not something like a torn ACL or, you know, some other sprain or strain in there. Splints on dogs, you got to be really careful because they get them wet or they lick at them, and if you get them too tight, they can get infection underneath and stuff. A lot of times, you know, there's places you can Google on the internet for temporary splints, but if you think that he's broke his leg and he's not using it at all, I'd bring him in and have him checked because a lot of times that can get a lot worse if it's not stabilized. So, but you're on the right track. You need to stabilize it. So.
All right, we're out of time. Thanks for bringing in Colonel Mustard.
Thank you. Thanks for having us. We're having a lot of fun here. He says, I'm ready to go.
He is. Well, if you missed any of today's segment, you can catch it again on our website, kjrh.com. Just click on the Lifestyle tab to watch it again. You can also learn about other pets who need homes and find out more about Heritage Veterinary Hospital.